Welcome back to the another video tutorial from TI Lectures. This is the second part of the video lecture what we are discussing about the new variant of the SARS-CoV-2, that is Omicron, right? So what we have discussed in the previous lecture regarding its transmissibility, how why this Omicron has been designated as a variant of concern by the World Health Organization, right? Because the large number of mutations found in its spike protein, and among which the 32 mutations have been found in the spike protein. And we also discussed that sometimes what happened, that's not unexpected thing that happen within our body, that the some viruses exchange the genetic material between themselves, and this might have happened with this type of the new variant. That's why that is a common means of mutation, by exchanging or swapping the genetic material between the two viruses, right? So keeping all this scenario in view and the grave consequences regarding its transmissibility or the immune system evasion, right? We can't neglect the preventive measures. That's very important, because we can't escape from the preventive measures, right? So what kind of preventive measures? Because the signs and the symptoms of this Omicron, they are not much different from other variants. However, some experts reveal that the fatigue, body fatigue, the joint pain, cold and headache are the common signs and symptoms of the Omicron that are a little different from that of the previous Delta variant, right? Apart from this, the loss of smell, the loss of taste, which were the common signs of the Delta variant, were hardly seen. Loss of smell, and loss of taste, loss of smell and loss of taste, which were the common signs of the previous Delta variant, were hardly seen in the case of the Omicron. They further added that Omicron might not lead to the breathlessness. The thing that's very important to mention here, that this may not lead to breathlessness, may not lead to breathlessness. That's important, that's very important, that this Omicron variant may not lead to the breathlessness like Delta or another previous variant of the COVID-19, because possibly the Omicron multiplies in the throat instead of the respiratory system like lungs, right? It means that unlike Delta, like Delta infection, in which large group of population was hospitalized and suffered from the pneumonia, the same might not happen in case of this Omicron variant. You got my point? So what we discussed, that this Omicron variant, it may not lead to the breathlessness, because it has been reported that this virus Omicron variant may multiply in the throat region of the respiratory system, and not in the lungs, as seen in the previous variants like Delta variant, right? So if we talk about regarding its the preventive measures, for example, what we regarding its preventive measurements, people are advised to continue to keep the enclosed spaces well ventilated, avoid much crowding, for example, close contact, or wear masks, clean hands frequently, right? And the most important is to get the vaccinated, right? That's very important to get the vaccinated. As because why we emphasize much more on vaccination, because renowned immunologists from across the globe, or the renowned immunologists from the UK have highly recommended the vaccination, and said that virus cannot possibly lose every single epitope. You got my point? So because of the what we talked about in the previous lectures, that because of the mutation in this spike protein region, and what immunologists said across the globe, they said that the virus cannot possibly lose every single epitope. Epitope means the part of the virus recognized by immune system of our body. So when it does not lose every single epitope, That means on its surface, because if it did so, if it loses the every single epitope, so that this spike protein could not work anymore. You got my point? So while some of the antibodies made against the previous variant of the virus may not be effective, but there will be others which will be effective, and there will be others which will remain effective. That's why vaccination is important. That's why the scientists across the globe, especially the immunologists across the globe, have emphasized on the vaccination. Got my point? So by looking all this scenario, by looking the mutations, by looking the difference between the previous variants and this new kind of variant Omicron, what we came to the conclusion that a robust, a strong immune system is important, that can help in fighting this highly infectious strain Omicron, right? So prevention is better than cure, and it's old saying that prevention is better than cure. And when it comes to the COVID-19, adhering to the basic SOPs, right, like wearing masks, what I talked earlier, for washing hands frequently, following social distance, avoid much crowding, like so while following while following a healthy diet and a fitness routine, that can go a long way in keeping this kind of infection at large. So to make our immune system strong, to make our immune system healthy, diet always plays an important role. Diet always plays an key role. Diet always plays an important and pivotal role, right, in making our immune system strong. That's important. So if we see the home cooked foods, the foods are rich in fiber, the foods are rich in vitamin C or micronutrients like green leafy vegetables, and the this some important foods that can give boost to the immune system and the health as well. You got my point? So in the next video lecture, we'll be talking about some important 2-3 kinds of foods which are very important, which we should add to our diet in order to make our immune system healthy, in order to fight off every infectious agent, whether we are talk of the bacteria or any kind of virus like Omicron. Thank you.